No, I'm Robert, fact checker and science blog, and helping people who are scared of many things. And this is about how we can stop COVID-19. It's entirely up to us. It's not up to the virus. We have these wonderful vaccines, amazingly effective, and these are going to make a big difference in 2021. However, we have the winter to go through, and we can actually stop it before then. This is New Zealand. This was in October in New Zealand. And there's no need for distancing, no need for masks. They have got rid of the virus. They did that without a vaccine. This shows the two of it together. It shows that and then it shows the graph. You see how what they did was test, trace, isolate. That's what they did. They did minor lockdowns. The most important thing was tracing and isolating. They followed the World Health Organization advice. The World Health Organization had given this advice since January, and then very strongly in February. So we could do that in the United Kingdom. We have got into this cycle of repeated lockdowns because our test, trace, isolate isn't working. That's the reason. And because people aren't doing the physical distancing and aren't doing the mask wearing. If you do the physical distance and mask wearing for a few weeks, and you do the test, trace, isolate, then it just goes zoom down like that. Tenfold reduction. Went down from 60 confirmed cases on the 1st of April to 2 confirmed cases on 26th of April. In cases per day. That's much more than a tenfold reduction. That's actually a 30-fold reduction in just 25 days. So just think about that. You know, you've got 1,400, you've got 200,000 cases, and in 25 days you could be down to 10,000, another 25 days down 1,000, then 100, then 10, and then it's gone. Then it's nearly gone. And that's for the entire United States. Without a vaccine, just by doing the other measures. That is why Biden in the United States is saying, wear a mask. You should wear a mask. But he's also saying, it's not just saying that, it's saying do physical distancing. Do them both. And when you've got the mask on, that doesn't mean you should go up close to people. You've got a mask, do the physical distancing as well. At least 1 meter back. The main thing is to step back. Do all that. Hand washing, this seems to be the most important thing. And then there's the hand washing, it's also, and then cleaning surfaces and so on. But the most important of all, physical distance, wear a mask. And we could, if all of us did that, we would be back down to there very quickly. And then people don't seem to make this connection. The reason so much of Europe and the United States, areas of the United States are in lockdown, is because people weren't wearing masks over the summer. And because they weren't doing the physical distancing. That is the reason. That's why we're in lockdown in Scotland, in England, and we're now in this tiered system. The reason we're in this tiered system, the reason that all this has happened, is because people didn't wear masks. And they didn't wear them properly, and they didn't have them around their mouth. And there was lots of reports in the United Kingdom, and because they weren't doing the physical distancing. Now, they didn't realise originally how important masks were. The reason was because they thought, German people they don't wear them properly. You just look at them. Hardly anyone wears the mask properly. They're always touching, fiddling with the front with it. They're worried about their chin. They do all sorts of improper things. So it wasn't at all clear that masks would work. Just because you can't expect the general public to use them like a health worker. It definitely works for a health worker. But will it work for the general public? It turns out it does. So even with all that sloppiness, the masks still do seem to help. So the virus is quite easy to protect against this virus, and so masks work, even as used by the general public. And that really is the reason why we got this changing advice. Because it wasn't because all along everyone knew that masks work. What they didn't know is if the general public could use them. And we just look around, the general public don't use them properly, but still if everyone does wear a fabric mask, then it seems that still is effective. More effective, surprisingly effective. That's why the advice has changed. you've got to do the physical distancing as well. Now, look, I did a calculation here of the world population. I make it about a fifth of the world population is already like this. That's a lot. And then you get people just making endless excuses. To start with, they said only an authoritarian regime can do test, trace, isolate. That was originally when only China had done it. And then they said China hasn't done it, and then they said China has done it. And they said, first of all, China hasn't done it, it's just a deceit. It's pretending to have done it. And they finally said, oh yes, China has done it. And they said, but only an authoritarian regime can do it. Then Singapore and Taiwan did it. And they said, well, they're not authoritarian, but they are Asian. Only Asian people can do this. And Japan did, and they said, well, Japan's Asian too. You know, they did quite effective response, not quite as good as just China. Taiwan is very good, China is very good, Laos is not a very good one, Vietnam. They said, oh well, they're all Asians. Asians can do it, but we can't do it because we're not as disciplined as Asians. And then we got New Zealand does it. They said, well, New Zealand is an island. United Kingdom can't do it because New Zealand is an island. That doesn't make sense. United Kingdom is an island. If it's an advantage being an island, then United Kingdom should be able to do it. Just like New Zealand did. Maybe we have to close down, maybe we have to have sort of quarantine of the Channel Tunnel or something. We could certainly do it. And but then you have places like Laos, which is completely surrounded by land, and Vietnam, and China. It shows that the places with land borders can do it too. You say, oh well, there's places with land borders can do it only if they're Asian, or places with land borders can only do it if they're authoritarian, or places with islands. You start qualifying things more and more, and until you manage to have a list of qualifications that only applies to the people who have done it, and or mainly to the people who have done it, and then you just have more and more excuses. And what they don't do is even try. The United Kingdom is not properly trying it. They know they have major problems. Lots of people not. Now, there is some good stuff going on. Are people starting doing a bit better? But I'm so ashamed of what we've done in the United Kingdom in this. Excellent what we do with vaccines, and the lockdowns, people are very disciplined with the lockdowns, but people are not doing the test, trace, isolate properly. They just aren't doing it. And the big problem was the United Kingdom centralised it. And they should have, this just doesn't work. It's good to have central organisation, but it doesn't work. And the World Health Organization said that right from the beginning. You have to empower communities. If you want an effective test, trace, isolate, empower communities. But the United Kingdom didn't listen to that. They have always been very insular throughout this entire response. They just say, well, we know how to do it. We've worked out our pandemic plans for flu. We're just going to adapt them a little bit, and that will enable us to deal with this. And it didn't work. And that basically is why things have gone so badly in the United Kingdom, because they didn't listen to other countries. Not even listen to the United States, to New Zealand. We've got an awful lot of connection with New Zealand, but I don't know, has our Prime Minister even, I know that Biden, soon after he became President-elect, he had a long discussion with Jacinda Ardern in New Zealand to learn from them. I don't know if our Prime Minister has done that. And we should be doing that. We should be having long chats with them, and with the Chinese, and with the Taiwanese, with anyone who has managed to solve this, to try and find out how to do it. So one of the things that they would have discovered if they'd done that is empowering the local communities. Our local authorities should be doing a test, trace, isolate. That would be far, far better, far easier. Another very important thing is to isolate people away from their households. And not force it, but to let them do it. Offer free hotel accommodation, supported quarantine, supported isolation. Not fine them if they don't isolate or quarantine, which is what our UK has done. But instead, you've got to get £1,000 fine for not isolating. The natural end result of that is that people say, well, I won't get tested, then I don't need to be fined. It's rather counterproductive. Because if they don't know that I've got it, then they can't fine me for not isolating. So rather perverse incentive to people not to, and we get very few people testing, even getting tested in the United Kingdom. So they should learn from other countries. So now you as an individual can do things about that. If you get COVID-19, then the tracing is absolutely abysmal in the United Kingdom. It's getting slightly better, but you can tell all your contacts. You can tell your friends that you've got COVID-19 and give them support yourself, the support that the contact tracers should be giving. Advise them how to isolate, tell them where to get good advice from the best you know. And if you are contacted with someone who has COVID-19, you ring up and then talk to them and try and find out when you were in contact with them. And if it was within 2 days before they got symptoms, then you should be quarantining. So we individually can do that. The way that COVID-19 spreads is that it's nearly always people who know each other who get infected. You don't get with flu, it's often strangers. With COVID-19, you nearly always know the person who has infected you. And that is why Test, Trace, Isolate has been so effective. And these apps about discovering if you were sitting next to a park bench with someone, it's not very likely that you would actually get it from someone on a park bench. You have to be talking to them, communicating face to face for 15 minutes. And generally, people who communicate face to face for 15 minutes with someone is generally not a stranger. Someone you just ask the way in the street, how do I get to so-and-so, and they show you on the map. It's not very likely you get COVID-19 from them. So it's generally people that you know quite well, because you don't tend to spend so much time talking to people if you don't know them. People that you're working, not necessarily friends, but people that you associate with, and you know their addresses and their telephone numbers, or you can find them. So that's why Test, Trace, Isolate works so well for COVID. It wouldn't work for flu, because it's very difficult to find the contacts. So all this effort on Bluetooth, that's really most needed as a reminder. It's not really strangers, and you get these false alarms of people you happen to be sitting next to but you weren't talking to, then they're not a contact. If you're side by side and you're not talking to them, you're just looking forward, they're not a contact. They shouldn't count as a contact, because there isn't really any possibility of them infecting you, because the droplets have to go face to face. So we can individually do that actually. And Mike Ryan advised that in one of his talks. He said that if I got sick, he said, then I would be telling all my friends that, and then I tested with COVID-19. I wouldn't wait for the contact tracers to contact my friends. I would tell them right away, all my contacts. And the rest of us can do that too. The sooner they quarantine, the better. And the contact tracers are so stretched, and they often don't even manage to get in touch with the contacts. So there's lots we can do ourselves. So anyway, that's what some physical distancing, masks, hand hygiene. We hopefully all know that. Test, tracing, isolate, quarantine, and there we are. Here we are, Mike Ryan for his golden wish. And then, yes, and so they need support. As Dr. Tom Friedman, former director of the CDC, he said quarantine should be a VIP experience. Make isolation and quarantine things people want to get into rather than get out of. We're more likely to succeed. And so, especially with the people in multi-generation families, then they really can't isolate at home at all. And that's partly why it was so devastating for them. People with poor people, not very wealthy people, who maybe don't even have rooms to themselves. Maybe even two people to a room, especially children. And in that situation, then it's very difficult to isolate. Still, the WHO do advise for people in that situation that you make sure the beds are at least a metre apart and you keep out of each other's way. It is possible to do some isolation even in multi-generation, even in families that are quite crowded. But it's far safer and far easier to isolate in a hotel. And if someone has COVID-19, and many people think, my spouse has got COVID-19, so I've got it. That's not true. It turns out that 80% of the people with COVID-19, don't transmit it to anyone, even to their spouse. And so if you can manage to isolate from a person who's got COVID-19 and use the WHO advice, wearing masks, you both should wear a clinical mask in that situation and replace the mask every day. You should isolate properly if your spouse has COVID-19 or if someone else in your household. You should try to isolate from them and then wear masks because you have to be close to them in order to care for them. But only, there's a long detailed advice from the World Health Organization, you can look that up. I've got an article about it. So, quarantine, but quarantine, it's the perfect quarantine is in a hotel, in a separate hotel with qualified people to look after you, where you're isolated from everyone else, and you're in your room, and I know it's rather boring, but you're saving lives by doing that. One way that my client put it is that if you isolate and quarantine, you are the end of the virus. It can't come to you. If you isolate or quarantine, you're the end of it. If you do the physical distancing, hand washing and everything, it doesn't even come to you. If you don't do these things, you are the start of the virus. It comes from you through to others and others, and then a few weeks later, could be 10 people, could even be 100 people got infected by you. If you are unlucky enough to be a super spreader, that could happen much faster. So you have the choice. Will you be the end of the virus, or will you be the start of the virus if it comes through you? And we all have that choice. We have the individual choice. Will I be the end of the virus, or will I be the start of the virus? If you have, even if you've got COVID-19 already, then you can still be the end of the virus, not transmit it to anyone else, by following the rules very carefully of isolating and by telling your contacts, so that if someone has got it from you, they can quarantine and not pass it on to anyone else. And if we all did this, it would stop very quickly. We wouldn't even need the contact tracers, because of this special feature of COVID-19 that generally people know their contacts. And then when so then we just in case, yes, I was 25 days. I put 20 days. I've got a mistype there. And then the automatic behaviour, when you interact, step back instead of forward. So this is called intentional. What's it called? Intentional something intentions. Do I have it written down there? Oh yes, implementation intention. You never get tired of an implementation intention. So implementation intention, I mean, like for instance, when you learn to play a musical instrument, you don't sort of forget it because you're tired. If you learn to ride a bicycle, you don't, when you're tired, forget how to ride a bicycle. When you're brushing your teeth, then you have this thing, in this particular situation, you brush your teeth in the morning or in the evening. If you're one of these people with regular habits, then you know how to brush your teeth once you start it, and it's pretty much automatic. And so when crossing the road, you look, most people, when they cross the road, they look both ways. Even they're quite absent, I'm very absent-minded, but I still look both ways when I cross the street. It just got drilled into me. And it's not, I don't have to think, oh, I'm about to cross the road, what is I'm supposed to do? I've forgotten. It doesn't work like that. We've got, our minds are marvellous things, and it just pops up. You reach this situation that needs this, and somehow we've no idea how our mind works. We don't know how, we don't know the nuts and bolts of how this works. Literally, we don't know. But our minds are marvellous things, and when we're in the situation where you need to be able to look both ways because you're about to cross the road, we just instantly recognise, oh, this is a road crossing situation, I've got to look both ways. You don't even remember it. You don't think about it, it's just automatic. So that is what we should try to develop with COVID-19. And then with the mask, always put it on. So the thing to do is, as a personal thing, be consistent. So learn what the habit is that you've got to do, and then don't go just dithering around, say, well, I'm talking to this person, should I, shouldn't, what's this particular, that is when it gets very tricky. You have lots of anxiety because you're always wondering what to do, and sometimes you do it right, sometimes you don't. You just look around and see what everyone else is doing. Try and make it automatic, and just remind the other person, I'm physically distancing. They should know what that means and why you're doing that. And then they'll just get used to you, and even they don't physical distance with other people, they will know that when they interact with you, that they physical distance with you. And so that can be your thing. But then you can try to explain to them why you're doing it, and then maybe influence others to do the same. So you should just always automatically, when there's space to step back, when it's not required by the job, when it's not crowded, step back at least a metre, even wearing a mask. Do that. If we all do this, what I'm just describing now, we could be back like this without a vaccine. We don't need a vaccine to go to that. The vaccine fills the gaps in our health response. And this is about how we should do the isolation and quarantine. So anyway, those are the main things I want to talk about. And this very roughly explains the reason that these things, actually the main infectious is what comes out when you're talking. Theoretically it happens by transmission via surfaces. I don't think, certainly for months, I don't know if they have even yet got clear proof of transfer via surface. If they have, it's very rare. So all this washing, now it may well happen. They do think it happens, but it's difficult to prove that it happens because most of the transmission is through speaking, and the other stuff complements it, and it usually happens at the same time. So it's hard to tell. So if you do the physical distancing, do the hand washing, and as well as an extra precaution, don't worry too much about stuff, things that you buy in shops or postal deliveries. You can, if you like, just wipe the outside. But the reason is a single virus does not infect you. It needs quite a lot of virus to get into you. And most people, when they've got infected, then if you hunt around, you'll find that there's been this situation where they were talking close to someone, or some situation where they had this opportunity to be infected. And not hardly a good opportunity, but that's how it happened. So that's it. That's the most important thing to look out for, is the physical distancing. And if you are just momentarily close to someone for a few minutes, then a single virus doesn't infect you. Your immune system fights it off without even having to do very much. It's only when you've got large amounts of virus comes into you that your ordinary immune system doesn't manage to fight it off. It manages to get into a cell, then it starts reproducing, and then eventually it takes off, and then you've got COVID-19. For some reason you need quite a lot of virus before that can happen, because the automatic immune system, which doesn't even know what it's fighting, sort of fighting almost blindfold, but you can fight it, can see it. And so here we are, and so here's this thing, that you do it all, and you can be like a Superman. So I'm just going to stop at this, 23 minutes, I think that's about right. Well, yeah, just a way of thinking about it. I think part of the thing is the timing. Like, would you go to this holiday destination if 1 in 1,000 tourists suddenly drop dead of COVID every year? Some US states are like that. This were delayed for 3 weeks. In other words, they do drop dead, but not on the beach. They drop dead 3 weeks later. And so, because it happens 3 weeks later rather than instantly, that's the main reason that people don't do much about it. It's a hidden problem. So that's really the thing that I'm, do something about it. And so I think that it's going to help with. So we need consistency. We need to be surrounded by it. But as an individual, you can do this anyway. You don't need to wait for the leaders to do it. You don't need to wait for everyone else around you to do it. But I think that actually no longer having Trump on television, taking his mask off, and all these rallies with people not physically distancing, then people are very herd orientated. When we see people around us doing something, we tend to do the same, not even thinking logically. So I think just no longer having him. He's now talking about his election thing. So because he's not talking about COVID-19 anymore, and the only messages we get are about physical distancing and masks, then that eventually is going to have a cumulative effect. And the cases rising so rapidly in the United States, doubling in a month, well, that is actually just quite a small increase in our note, and just a few percent people from many states has already moved it down to below 1. So many of the states are steeply going down. Like North Dakota is steeply going down, as steeply as it went up. And that just doesn't require very much. It doesn't take a lot to turn it around. And then, doing this now means that when we have plenty of vaccine, then we'll get rid of it very quickly. We don't need to vaccinate everyone. So if we could get back to the situation it was in the United Kingdom in the summer, for instance, then it was only present in a few places. In Scotland, then there's only a few in a million in Scotland, and it was just, and most of those were in hospital or isolated. And so if you can get back to that situation, then you'd only need to vaccinate a few cities or a few towns, a few communities, and then it's gone. So you have to vaccinate the people in advance. If the community is spreading, then your first vaccination dose will give a little bit of protection. And it's, I think it's 3 weeks for the Pfizer one. That's what they're going to do in the UK, and another 7 days. I'm not sure why. I'll say 28 days. UK is say 21 days, and then another 7 days. And so so it's about 28 days total. And before you've got the immunity. So if you've got spreading community spread in a city, then you would do everything else, but you also vaccinate people. Then that means at least a month later, if it's still lingering there, then it will go away very quickly. So we need to think about it like this. We shouldn't, if we rely on the vaccine to do everything, we just go in and out of lockdown, until we get a vaccine, which is basically what the UK is doing. Then they're saying, we're going to come out of the vaccine, we're going to come out of lockdown for Christmas, but we've got to go immediately back again after Christmas. Or not lockdown, these tiered systems and so on. And they expect a big surge in it over Christmas because they don't expect people to do the physical distancing properly over Christmas. So, and they're not going to be doing the test, trace, isolate. Still lots of problems with that. It's not really working properly. So, if they could get that really working, get people doing the physical distance and everything, there's no reason to just resign to this and say, oh, we're just going to have to go into repeated lockdowns until we've got the vaccine. We don't need to do that. And this can start as an individual by being responsible about it, by doing the physical distancing, washing your hands, mask wearing, encouraging others to do that, and doing the isolation and quarantine. Then you can make sure you're the end of the virus instead of being the start of the virus if it comes through you. Anyway, so that's that. And so I just want to say, and the situation is very promising. We can expect to have most of the country, most of the world vaccinated by the end of 2021, and we'll have most of the United States and United Kingdom, Brazil, Mexico, India. It turns out many of the worst places, and most of them will be vaccinated by the summer. Where else? Japan. Trying to think of all the places that have already booked. Canada, most of Latin America. No, I'm not sure how much of Latin America now. Certainly Brazil and Mexico. So with the big places, these happen to mainly include most of the places with a huge amount of transmission. And so once they've got rid of theirs, then, because we, in the United Kingdom and the United States, are not just our problem, we have made it worse for the entire world. It's very difficult for the rest of the world to eliminate COVID-19 for as long as we've got it surging and raging in the United States and the United Kingdom, because people go back and forth and they take it from the United States to other countries and from the United Kingdom to other countries. So, and Brazil and Mexico. For instance, Brazil got it from Italy, I think, and where was it? Nigeria, I think, got it from the United Kingdom, and South Africa from, I think, that's the United Kingdom, I'm not sure. And so when you have these big areas, big populations, then they export it to other countries when you have big surges in cases. So it's very important that I think the first step, I think it's rather lucky that the vaccines are going to target these big populations, and as a result then this is going to reduce it very quickly in the worst regions, most of the worst regions, India, Brazil, Mexico, United States, United Kingdom, Europe generally, and Western Europe. They should all be pretty much virus-free by the end of the summer in 2021. And at more than a fifth of the world is virus-free, surely we'll have half, but you've actually got enough doses to vaccinate about 2/3 of the population. At the 20% that's already virus-free, and we could have 4/5 of the world's population be virus-free just using their vaccines that have been pre-ordered already, assuming the wealthier countries give their extra doses to the other countries. Then we could vaccinate, because for instance Canada has over-ordered 9 times. It's got enough vaccines, it's pre-ordered enough vaccines for 9 times its population. Meanwhile, the COVAX Alliance is barely struggling to reach 3%, 4% I think. I think it's got enough pre-ordered enough doses for 4 or 5%. Whereas the United Kingdom, again, several times its population is pre-ordered. So hopefully some of the wealthy countries that have pre-ordered so much of the vaccine, and as a result there's very little left for the rest of the world, and hopefully that they're going to give their doses to the rest of the world, and they're going to fund COVAX so they can buy these doses for the countries that can't afford them. I think it'd be absolutely appalling. We've ordered 10 billion doses now for 5 billion people, mainly in the wealthy countries. COVAX, which is for the poor countries, has ordered enough doses for 300 million people, 350 million people pre-ordered. And this is just so unbalanced. And as I said, most of the wealthy parts of the world have pre-ordered far more than they need. And by doing that, then they're delaying the time for vaccinating of the rest of the world. And then only, I don't know when, the UK would release its pre-orders and say, well, we've got enough for the Pfizer vaccine, you can have half of AstraZeneca or something. And I don't know what point that's going to happen. But it really is a kind of vaccine poverty we've got in the world. It's really good that we've got COVAX at all, that's very positive. But it would really help if they got more support. They need another $5 billion, I think. And look at the trillions of dollars that the countries have spent, giving them $5 billion so they can buy enough doses for 20% of the rest of the world. That's the donation that they're waiting for. It hasn't come yet. They've got enough for 4 or 5%. They haven't got enough for the 20%. And so they can't actually buy them. And that's why they haven't pre-ordered them. And so that's the situation we're in. So I just want to encourage, if you have anything you can do, anything say of influence to influence people who are doing this stuff, and can we start thinking about what we're going to do about the excess doses that the United Kingdom has ordered it doesn't need, especially the doses like AstraZeneca that are especially easier. So it would make sense for the United Kingdom to use the more expensive Pfizer and Moderna doses where we can, because that's very difficult it's not impossible, it's very difficult for somewhere like the Congo or India or somewhere or whatever to use those particular ones because of the cold chain. And so we can do it, especially the Moderna one. Moderna one is much more feasible because it can be kept for 30 days in the fridge. That can be used throughout the world, but even then it's somewhat easier. AstraZeneca is somewhat easier. So anyway, so I'm saying that we should at some point we should look at our pre-orders and say and once we've got especially once we've got the vaccines approved, and we've got enough vaccine approved so we know we've got pre-orders for more than our population, and that's going to happen in the next few weeks. that many countries are going to discover that once AstraZeneca, Moderna, Pfizer, and probably Novavax or something will be, I don't know which one will come next, but there will be a point quite soon, before the end of December, I'm pretty sure that most of the Western world, of the more developed countries, will have pre-orders of approved vaccines, approved for emergency use, that exceed their total population. And in several cases, there would be several times their total population. So I hope at that point they don't hold them, and they give their vaccines away to the people who need it in order to stop it as fast as possible. Because we help the entire world. We need to stop it together for as long as it is circulating somewhere. And then you get people on television and say, it's endemic, it's just, we can't stop this, it's just going to go on and on and on and on. Well, this is a way that we can make it stop. Because stop it over the entire world, we can't just stop it in the United Kingdom. Instead of just saying, we're never going to end it, instead of saying, well, we've got too many doses, if we give that to other parts of the world, then we can end it much faster. Because if we synchronize this over the entire world, then we can end it much faster. Because you don't have it continually coming up again. As long as you've got, say, even if you enter the United Kingdom in Europe, but it's still raging in I don't know, Guatemala or somewhere, then it's not ended from the world. It's going to be coming back to continually being imported into Europe and the United States from time to time whenever there's a traveller, unless you kind of quarantine off these places. And and then if you quarantine off, then you're diminishing trade, diminishing travel, diminishing tourism, and it's bad effect on the world economy, and the world economy, we all are affected. China managed to, because it ended its one so quickly, and New Zealand, then they have much better effect. But China has actually got positive GDP growth in 2020. This doesn't just benefit China, this benefits the entire world. The United States can export and import to China. If China had got negative GDP growth, then the whole world would be in a much worse situation economically. Not just China. It's not just China is benefited by its positive GDP. The entire world is affected. Sorry, I read this from I had this in my lap and I just it fell down. Anyway, so I will stop at this point. That's a good point to stop. So, just encouraging people, be generous, be thoughtful about others, do be careful about COVID-19. Stop it even if you don't feel any risk of it personally. Stop it for others. Even if you're not bothered about yourself, stop it for others. And that includes people you know very well. There have been so many tragic stories of people who've died young, even died 50, 60, 40, and the people died 20s, and there have even been some young children who have died, although it's very rare. And none of those deaths need to have happened. They could all have been prevented if we had followed the World Health Organization advice in February. We could have eliminated, back then, there were only 100 cases in the world outside China. And the World Health Organization said to everyone that you've got to start monitoring in your community. As soon as you've got community spread, start monitoring everyone with flu-like symptoms. And check for COVID-19. We didn't do that. And they said we've got to be prepared for an increase in cases. We've got to get our PPE sorted out. It's out in February. We've got to get tracers trained. We've got to be ready to have a whole lot of tracers all ready to start work. And we've got to have worked out how we're going to quarantine people, how we're going to isolate people. So all those hotels should have been worked out in February, that I was talking about. Not now, ad hoc. Because the World Health Organization, they respond to perhaps a couple of hundred epidemics a year. And they're very familiar with the sort of things that are needed. And they could see these problems coming months ahead of everyone else. In February, they were saying, this is what's going to happen. They said, you're running lean and mean, and the most developed countries are going to be affected by this. They warned United Kingdom, United States, everyone, your health system is going to be hammered by this. You don't have the capabilities to look after these people, and they were just ignored. So this is very positive from the other side. So if I listened to every single press briefing, and I was just so frustrated looking around and just seeing my government doing nothing. World Health Organization warning over and over and over, they were doing press briefings every single day, every single working day early on, 5 days a week they were saying this. And nobody was listening in the United Kingdom, in the government. They just weren't listening. So there was no need for any of these tests. We could have stopped it at 100 cases outside China. We now know that there were many other cases, but we would have found them with the flu, testing flu-like symptoms, and we found them quite quickly, and we could have stopped it. So that is just so sad. But on the other hand, it's so positive that we have now got the vaccines. We are turning it around. So something that we had a big mistake, things went very wrong, and we were very late in responding. But we are now turning around and responding to it. And the main reason that Singapore, so it's not that they're better people in China or Singapore or in Taiwan. The reason is because they were badly affected by SARS. So because they had this previous history of SARS, which was stopped with test, trace, isolate, and they had the experience of it actually working. And in the United Kingdom, we're not badly affected by SARS. We have no experience of test, trace, isolate working. And we think of it as being like flu, and you can't stop flu in that way. And so we are very maladapted. We just didn't have the muscle memory of dealing with something like this. So that's partly why we were so slow in responding in the United Kingdom. Our government just didn't have a clue, because it hadn't encountered something like this before. As a collective organism, there were individuals within it who would know, but the collective organism, collective community of the government just didn't have that muscle memory. And so you get these doctors kind of saying to the government, no, do this, you've got to do that. And they just weren't listening, because as an organisation they hadn't got that muscle memory of how to deal with something like this. And that's basically what happened. And that's why we got the pandemic. So anyway, but it's very promising. We can end it. Absolutely we can end it. And we can end it very quickly if we all do these very effective measures that do work. They absolutely do work. 20%, a fifth of the world population has shown that these things, that's not even what I'm not sure what happened there. I think I seem to have lost the page. Maybe I accidentally closed it. So anyway, I will stop this. And so we absolutely can do it. So the self-replicating negative, look at it very positively. We could have stopped it in February. In the same way, we can stop it now. If we do now what we should have done in February, then if we had the right muscle memory, then if we do that now, we can still develop that. And as an individual, you can do that. Every single person can do your bit to help stop COVID-19, whether by doing physical distancing, by mask wearing, by talking to people, sharing things, sharing the good information. That's another way to help. We can all help end this. And we can end this very quickly if we do this effectively and properly. And we can protect ourselves and protect our loved ones, and there's no reason, if you're very careful, then you could go through this pandemic without running any significant risk. It's like crossing the road. When there's traffic on the roads, then if you don't know your highway code, if you don't look left and right, you are at a significant risk of being run over by a car. If you know your highway code, if you look left and right, look all ways, they now say. When I was young, they used to say look right, left, right. Now they say look in all directions. Anyway, if you do that, then you have a significantly reduced risk of being killed by a car. In the same way, if you do the physical distancing and the mask wearing, and then if you are contact to quarantine, then you're careful about that too, then you have significantly reduced risk of being killed by COVID-19 or of getting long COVID which for a certain percentage, they seem to have very different ideas about what the percentage is, anything between a few percent to one study recently found 50% in the febrile hours with long COVID. So it seems to vary according to population and how you study it. But that's people who are still sick 2 to 3 months later. And quite a lot of people get that as well. And that's not nice at all. It's really rather horrid. So you do survive, but you're going to be very ill for a long period of time. So you don't want that either. So you can stop that. You can be as safe as you are crossing the road with traffic. And when you go around doing your shopping with COVID-19, you can be as safe from COVID-19 as you are from cars. If you do the right things to protect yourself. And so, to try and make it what you call it, intentional. I forget that name again. Something intentions. Yes, it's to do with the context. Oh yes, here we are. I'm actually on the debunking page. The implementation intentions. I've got it now. Implementation intentions. Then to try and develop an implementation intention to step back whenever you encounter someone and you're about to socialise with them. Do that, and that's really, it's like looking both ways when you cross a road. It's exactly the same kind of thing. And in the same way, it saves lives and it saves sickness. It saves you from suicide, it saves you from getting very ill. Like if you're knocked over by a car and you survive, then it saves both of those. So please, if you're listening to this, then I hope this encourages some of you to develop an implementation intentions for protection against COVID-19. You can do it. We can all do it. And if we do that, then we can end this much, much faster. Now let's find the thing that I've got. Here we go. Where is it? Stop.